Serial ECGs. When is the last time you thought about getting them in a patient who had a suspicious story, but a non-ischemic ECG? Well, take a look at today's case and see how these paramedics thought this through. So here's the case. This was a 55-year-old male with a history of intermittent chest pain ongoing for the past 1 month. The pain was worsened with light exertion and improved with rest. Now, he reported no associated symptoms such as nausea, vomiting, shortness of breath, sweaty spells, or dizziness. He was a non-smoker, and there's no really pertinent family history. Now, the patient finally went to his PCP because his symptoms just weren't getting better, and after the workup there, given the patient's age, his history of chest pain, and the appearance of the 12-lead ECG, a 911 was called for him to have a further evaluation in the emergency department. Now, when paramedics got there, here's the first ECG they obtained, and take a look at it. Pause the video here and see what they were concerned about. Now, they saw what was elevations in lead V2 and V3, but subtle changes and mostly straightening in lead V2 and V3 that was not really a STEMI, but concerning enough for them to say, hey, this isn't quite right. And there you go. There's V2 showing some straightening, and there's lead V3, again, with some straightening and mild concave elevations of the J point. Now, the medic taking care of this patient didn't really like the appearance of the first ECG, so he went ahead and got a second one. And here is the second ECG done about 16 minutes later. And looking at it, he said, you know what? This doesn't seem any better. It may even be worse. And once again, drilling down on the anterior precordial leads, V2 and V3. Again, the straightenings are still there, but a bit worse, along with worsening ST elevations, even concave, but still worsening. You can see some straightening there, V2, and elevations in lead V3 also. This was actually a somewhat long transport time. So about 4 minutes later, now this is 20 minutes after the first ECG was obtained, they got a third one that again showed this. And now they were, quite concerned about the appearance. And drilling down on the lead, on the precordial leads again, you can see V2 and V3 show some elevations that are significant. And I can see the J point quite elevated, although concave, they're still elevated. And a new finding here showing an upright T wave in lead V1 compared to V6. And that we've talked about before, we'll talk about it again, is concerning. So here are the dynamic changes at T 0 minutes, T plus 16 minutes, now showing J point elevations about 2 millimeters. And then T plus 20 minutes now showing J point elevation in lead V2 of about 3 millimeters, a little bit less than V3, but still you can see the dramatic changes. And one more thing, look at lead V1. There's now a new upright T wave that was not present in the other ECGs. And this is called loss of precordial T wave balance. We've talked about this before, but it's worth mentioning again. If you look at this, you see inverted T waves normally and upright T waves in V6. But here in the third ECG done 20 minutes later, what you see here is a newly upright T wave in lead V1 that is significantly larger than the one in V6. Again, loss of precordial T wave balance, a predictor of ongoing ischemia. Case outcome, how did he do? Well, the paramedics correctly called this in as a STEMI, but there was some confusion, and on arrival at the ED, they got placed in the waiting room. The patient was in the waiting room for, I think, a protracted period of time, and unfortunately signed out, left the ED without a full workup being done. That, I think, was a huge, huge problem, a big mistake. And hopefully the patient did well, but we'll never know about that. The data, well, the literature says, going back to 2016, there's a Canadian study that showed the value of dynamic changes in pre-hospitally acquired 12 ECGs. And, there's about an 8.1% change in patients who had end STEMIs who then became STEMIs because paramedics did serial ECGs. And the second point they bring up is that, when you see changes like this, it may actually change the way patients are handled in the field, and they may be diverted to a more appropriate facility. Instead of going to their destination hospital, they might go to one that might have PCI capability. So that's a huge advantage, right? And lastly, accurate interpretation in the pre-hospital arena, getting serial 12 ECGs actually improves outcome dramatically. That, again, I think is a really important concept to understand. So anyhow, that's it for this week. Thanks so much for joining me. Until next week, this is Sush. Take care.